Did you know that sore throats can break your heart or cause twitching or obsessive compulsive behavior, or perhaps even kill you? Sore throats killed Mozart and Darwin, sort of, and that guy from Aliens too. Stay tuned and I'll explain how. Hello all you sick people. Here is a typical scenario. Your child wakes up one morning with a severe sore throat. 2 questions immediately enter your mind. 1, do I need to go see the doctor? And 2, does my child need antibiotics? Well, given that I just mentioned how sore throats can have fatal complications, it's always a great idea to have a sore throat checked out by a doctor. But the majority of sore throats will not need antibiotics. However, there are some hugely important exceptions. If your child does need antibiotics, they can be very important and perhaps life-saving. And the reason for the antibiotics may have nothing to do with treating the original sore throat. So, today, even though I may get in trouble with the union, I'm going to explain to you some doctor secrets that we use to decide who doesn't need antibiotics, who does need antibiotics, and who really needs antibiotics. About 1% of visits to doctor's offices are for sore throats, or about 20 million visits per year, at a total cost of nearly $500 million. The child is usually between age 5 and 15, and the most usual time of year for throat infections is late winter and early spring. Symptoms are fever, a sore throat, swollen tender lymph nodes in the neck, and in the back of the throat you will see enlarged tonsils, which may be covered in white pus. The first thing your doctor will want to know is what germs are causing the sore throat. About 80% of sore throats are caused by viruses, and only 20% by bacteria. Routine antibiotics don't work on viruses, and therefore there is no need and no point in giving your child any antibiotics. Common viruses that can cause sore throat include the common cold viruses, the influenza virus, the Coxsackie virus, which causes hand, foot, and mouth disease, the herpes simplex virus, which is the virus that also causes cold sores, the Epstein-Barr virus, which causes infectious mononucleosis, or the kissing flu, and the human immunodeficiency virus. Here is a closer look at the Coxsackie virus. Hand, foot, and mouth disease is a very common childhood illness that is easy to diagnose because it causes spots on the hands, feet, and mouth. The virus can occasionally go on to cause meningitis, and note that this is not related to hoof and mouth disease, which is a disease of cattle. However, the other 20% of throat infections are caused by bacteria, and these infections can be treated with antibiotics. The most interesting customers are Neisseria gonorrhea, Corynebacterium diphtheriae, and the one who's going to be the star of our show, the Group A strep. I want to talk about these guys because they're fun, and if they're not treated properly, there can be all sorts of complications. But there are all sorts of other bacteria that can cause a sore throat that I don't have time to talk about today. Let's just call them the usual suspects, and note that with all of these bacterial infections, without treatment, there may be some preventable complications. Neisseria gonorrhea is the germ that causes gonorrhea, and it can also affect the throat. Of course, this is not typical in young children. It's most likely in post-pubertal individuals who get gonorrhea from direct contact, like eating cucumbers. Next up is Corynebacterium diphtheriae, which causes diphtheria. This is serious stuff, because the mortality rate of diphtheria can be as high as 20%. There used to be 200,000 cases per year. Now, thanks to vaccinations, there are less than 1,000 cases per year. This shows that vaccinations really do work. Yes, I know vaccinations scare some people, but they truly are a good thing. The residual 1,000 diphtheria cases are typically from immigrants from countries where vaccinations are not done, or from children of parents who are too poor, for vaccinations or decide for other reasons not to get their child vaccinated. Children die because of a thick membrane of pus that blocks off the back of their airway. They also develop such huge enlarged neck lymph nodes that they can have what's called a bull neck. And now we meet our number one villain, the sneaky assassin. And like most villains, it has a few aliases. We tend to call it strep throat, but its full name is Group A beta-hemolytic streptococcus. Its most common alias is strep pyogenes, meaning the strep that likes to cause pus. For the time being, let's just call it Group A strep. Think of Group A strep as being an assassin that is very good at disguises, just like John Malkovich in the movie Line of Fire. The actual germs are attractive little spheres who like to link together into chains. Sometimes they act like sleeper agents. We can find them in 20% of throats that aren't even sore. We call these people asymptomatic carriers. Strep is present, but it's not actively harming anyone. But occasionally, Group A strep decides to gun up and cause a bunch of mischief, and a sore throat happens. But now we have a predicament. We know our assassin is out there, but not which throat he's going to strike, and we can't give everyone antibiotics. Remember that of our 20 million throat infections, 80% are viral, and antibiotics will be a waste of time. There's a 20% chance that the infection is bacterial and may have some serious complications if we don't give antibiotics. That is 4 million sore throats. And of those 4 million sore throats, only 10% will be Group A strep, which is the spy we are truly interested in which case antibiotics are really, really needed to prevent possible death. So, how do we find our assassin? Somehow we need to find out who has an actual strep throat. So we look in the kid's throat, check the fever, feel for swollen lymph nodes, and so on. But how can doctors tell which sore throats are dangerous and which are only annoying? The secret is we can't. We sort of pretend we can, but really we just can't. Our strep assassin is just too inconspicuous, is too good at hiding out. There's absolutely no way of telling, just by looking at a sore throat, whether it needs antibiotics or not. The best we can do is a kind of scoring system to make educated guesses. Think of it as gathering circumstantial evidence for our killer, clues that we might have the right germ. We already know that of all sore throats, only 2% are likely to be true strep throats, just based purely on population statistics. If a child has a fever, we give it 1 point. If the child does not have a cough, that's also good for 1 point, because coughs go along with other infections like the common cold or a chest infection, not with strep throat. Swollen tender neck nodes get another point. Tonsils that are swollen and covered with pus get another point. And if the child is between 3 and 15 years old, you get another point. From age 15 to 45, you get 0 points. And if you're over 45, you do not get a point. You get a point subtracted because people over 45 rarely get a strep throat. So what do these points tell us? If a child has 0 points or negative points, we are at the baseline population risk of 2%. Having 1 point raises this risk to 10%. 2 points gives us 25% risk. 3 points is 30%. And 4 points or more means there's roughly a 50% chance that the throat is caused by the Group A streptococcus. 50% is more helpful than 2%, but it is still no better than flipping a coin. Heads it's strep, tails it's not. You could get the same accuracy just by flipping a coin. Since this is a potential deadly infection, some people would elect to start antibiotics at this point. They would be wasted on half of the children, but that's not actually a bad average. Imagine how happy you would be if the government only wasted half of your tax money. But since our diagnostic skills are still no better than a coin flip, we need lab tests. There are two types of lab tests for identifying group A strep: the rapid antigen test and the throat culture. The rapid antigen test can be thought of as having a police lineup of suspects. If a positive ID is made, we can go straight to antibiotics. If the rapid antigen test is negative, or can't decide, remember, our assassin is good at disguises, then we need to do a throat culture. This is like sending a sample to the lab for DNA or fingerprints. It takes a day or two to get the results back, and once again, if they are positive, then antibiotics are definitely needed. No one ever wants to give a child unnecessary antibiotics, but with strep, a full course of antibiotics is needed to prevent future misery, even if the sore throat is already feeling much better. The reason is that, like a good germ should, this strep starts to engage in germ warfare. A few days after the throat infection begins, the strep starts releasing several toxins, including one named erythrogenic toxin. Erythro means red and genic means causing. The toxin is named this because it turns everything red. Sometimes adults get affected by this toxin and develop what is called toxic shock syndrome, and often children develop a bright red rash and fever known as scarlet fever. Of course, the body's immune system has to respond and lets loose with countermeasures, and a few weeks later, this immune system response can lead to something called rheumatic fever. As you might guess from the name, this causes a fever and sore joints, but also damage to the heart, kidneys, brain, and panda. More about that in a bit. Children with scarlet fever have a red face, but with a zone of paleness around the mouth, a strawberry tongue, and a body rash that looks like sandpaper or sunburn on goosebumps. The skin becomes particularly fragile in areas of friction, such as flexion creases, and the body rash will be worse there in what are called Pastia's lines. The skin may also slough off, especially on the fingers and toes, for up to 6 weeks after the initial sore throat. And all of these complications can be prevented by prompt antibiotic treatment of the initial sore throat. Rheumatic fever happens a few weeks later when the body's immune system reacts to the strep and tries to eliminate all of those toxins. Unfortunately, the strep is extremely good at masquerading as parts of the body, hiding itself with a process called molecular mimicry. So the immune system attacks many of the body's own tissues, including the heart, where it causes what is called rheumatic heart disease, the kidneys, where it causes post-streptococcal glomerulonephritis, the joints, where it causes rheumatic arthritis, the skin, where it causes rashes called erythema nodosum and erythema marginatum, and the brain, where it causes Sydenham's chorea, also known as St. Vitus dance, and PANDAS, which is an acronym for Pediatric Autoimmune Neuropsychiatric Disease associated with strep. With rheumatic heart disease, there is inflammation of the entire heart, often creating long-term damage. There are currently 30 million people in the world who have permanent heart damage due to rheumatic fever from a strep throat. It causes heart failure, irregular beats, and valve damage. In the US in the 1920s, rheumatic heart disease was the #1 killer in the 5 to 20 age group and was second in the 20 to 30 age group. This has diminished dramatically since we began treating the sore throats with penicillin. Worldwide, rheumatic fever is still the most common cause of permanent heart disease. People may need open heart surgery to repair damaged valves. This picture is of a boy who needed open heart surgery because of rheumatic fever. I will include a link to his full video so he can tell you himself how the rheumatic fever changed his life. When the kidneys are affected, it is called post-streptococcal glomerulonephritis, which is quite a mouthful, but is just a fancy way of saying post-streptococcal screwed up kidneys. This can cause fluid retention, puffy eyes, high blood pressure, and all of which may require medication to treat. Unfortunately, taking antibiotics ahead of time for the sore throat does not prevent post-streptococcal glomerulonephritis, but antibiotics will be needed anyway to get rid of the infection and to preserve kidney function. When joints are affected, rheumatic fever can cause many weeks of large joint inflammation that is asymmetrical around the body and usually starts in the legs and then moves upwards. Note that this is called rheumatic arthritis, which, despite the similarity in their names, is nothing at all like rheumatoid arthritis, which is a totally different condition. The joint involvement is less severe than with the heart, which has led to a famous historical epigram, "Rheumatic fever licks at the joints, but bites at the heart." There are two skin rashes associated with rheumatic fever, erythema marginatum, which just means a red rash which has a margin, and erythema nodosum, which means a red rash that comes in nodes or bumps. It's most common over the anterior shins and is not painful. These rashes are useful for diagnosis, although they are common with many other autoimmune diseases. They are not serious and not dangerous. Strep throat and rheumatic fever can affect the brain, causing Sydenham's chorea or St. Vitus dance, and pandas. Sydenham's chorea is when the rheumatic fever attacks parts of the underside of the brain. This results in tics, twitches, and jerks, and can be confused with Tourette's syndrome. I will put a link to the video of this young girl in the picture. You will see that she's constantly making herky-jerky movements of her arms, which are completely involuntary and not under her control. Pandas are a relatively recent discovery. Children may abruptly develop behavioral tics or become extremely OCD immediately following a sore throat. Once again, this is due to brain damage caused by the strep throat. To summarize strep throat, sore throats are very common, but can be dangerous. 2% of sore throats are true strep throat caused by the group A beta-hemolytic streptococcus or strep pyogenes. It can be treated with antibiotics, which decreases some of the complications. These complications can include scarlet fever, which is caused by erythrogenic toxin and causes red rashes and skin sloughing. It can also include rheumatic fever, which can lead to rheumatic heart disease, which is potentially fatal. It's uncommon nowadays because we treat strep throat properly with antibiotics, but still causes 300,000 deaths per year worldwide. Kidney damage from post-streptococcal glomerulonephritis can cause fluid retention and high blood pressure. There are also temporary skin and joint reactions, and the brain can be permanently affected with conditions like Sydenham's chorea and pandas. As a general sore throat summary, the majority of sore throats are caused by viruses and do not need treatment. But accurate diagnosis is essential because there are some sneaky assassins out there. Vaccinations prevent 200,000 diphtheria deaths per year from sore throats. Antibiotics can prevent some of the complications of strep throat, scarlet fever, and rheumatic fever. This is also the place to mention that I've seen a lot of videos online suggesting alternative medicine treatments for sore throats, such as herbs, acupuncture, or neck manipulations. Now that you're sore throat experts, you can see how foolish and even dangerous these treatments would be. And many of them claim to boost the immune system, which, if it was true, would not be desirable because the immune system is what causes the complications of rheumatic fever. There's a lot more to know about sore throats, but this video is already pretty long. Please leave any questions or comments below, including any topics you would like me to do future videos on. And I promise to tell you about Darwin and Mozart. While Darwin was at the Royal Society of London telling them about his theory of evolution, his son Charles Darwin Jr. was at home with a sore throat and eventually died at 18 months of age from complications of scarlet fever. Mozart's death certificate states that he died of Wassersucht. Modern experts now believe that he died of complications of kidney disease from post-streptococcal glomerulonephritis during an epidemic of strep throat that broke out in Vienna in the summer of 1791.